So again, this question is to both the orthodontist as well as surgeons. How feasible is a surgery first approach? So what is surgery first approach? We try to do the surgery first and then try to do the entire part of orthodontics together. So my question will be, what are the benefits of surgery first approach and what are the indications of surgery first approach, and how can we choose the patient in a correct way for a surgery first approach? Sir.
Okay, so first I would like to comment what is surgery first. So as Dr. Jugal mentioned, in conventional approach, first we do pre-surgical orthodontics, which involves decompensation of the teeth. Because of the jaw deformity, teeth tries to get compensated, they try to go into the best bite, but they are not aligned as per the jawbone. So when we do conventional approach, we first need to decompensate the teeth. So we have to align the teeth as per the jawbones, not looking at the opposite teeth. That usually takes around 8 to 12 months time, and then we do jaw surgery, and that is followed by post-surgical orthodontics, which again takes around 6 to 12 months of time. In surgery first, after proper evaluation, after proper study and after proper planning, we initially do jaw surgery, and that is followed by the orthodontics. So the advantage is that we don't waste a lot of time in pre-surgical orthodontics. Second advantage is the jaw deformity is corrected immediately and the braces treatment can be continued post-surgery. Third advantage is there is a phenomenon which we call wrap, so that allows us to make the faster teeth movement, so the total timeline for the orthodontics also reduces. But definitely when we do surgery first, we need to do a good planning, so the plan can be executed properly, and with proper planning, probably many of the cases we can go with the surgery first. I think Dr. Hers can comment further on this.
Most of the things well explained by sir. So nowadays surgery first approach is gaining momentum, and most of the patient is asking for whether can we undergo for surgery first approach without orthodontics also. So in surgery first approach, the first and foremost advantage is psychological benefit. Immediate correction of the jaw deformity is visible and patient feels very happy, and psychologically it gives immense positive motivation to the patient. But case selection is equally important. All cases cannot be done with the surgery first approach. Almost 30 to 40% cases we can proceed with the surgery first approach where there is no severe crowding, but means in case of mild and moderate crowding we can go ahead with surgery first approach, where there is a arch widening and there is no restriction in the patient's maxillary or mandibular arch. If arches are constricted, then we may need expansion with the orthodontic, or in surgical approach then we can go ahead with orthodontic surgery. Third is when patient is willing for surgery first approach. Sometimes patient's choice is equally important. So if patient is ready, we can proceed with the surgery first approach. Crowding, expansion, crossbite, and if severe decompensation is required with the orthodontic means, then also surgery first approach is slightly difficult path to take. So in such cases we can avoid surgery first approach. The rest all cases can be managed post surgery first orthodontics also. It is not that difficult. Nowadays more and more crowded cases or severe cases are also planned with the virtual surgical planning, so that we can predict the actual outcome post surgery. So if we are utilizing the softwares like MemoFab and we are doing virtual surgical planning where we can superimpose and we can simulate the treatment outcome, means these facilities are expanding our horizon for the surgery first approach. So surgery first approach requires both experienced maxillofacial surgeon also and orthodontist also. So for beginners it may be slightly difficult.
Right.